So welcome, everybody. My name is Dr. Jonathan Preston. I am an associate professor in the Department of Communication Sciences and Disorders at Syracuse University, and I am the chair of the admissions committee here. So those of you who are interested in applying to our graduate program, I'm likely going to be the first person to set eyes on your applications. So let's see. Our agenda for this evening is going to be an overview of Syracuse University's programs. We'll discuss our application process and some facts about how we review applications and our previous cohorts. We'll give you a virtual tour of our clinic, and we have some students who've recorded some testimonials for us that we'll share. We're then going to have some chance afterwards to do a question and answer with faculty. So we're going to do breakout rooms and put all of the prospective speech language pathology students in one room with some of our current faculty, and we'll put the audiology students in another room. And then we'll reconvene for just a moment, and we will introduce you then to some of our current students. So you're going to have a chance to ask questions of students who are in each of the programs as well. And the faculty will not be in those breakout rooms, so you'll have a chance to be honest with them. And then we'll have a chance to be honest with you. As a brief introduction here, we're going to meet our audiology faculty and then our speech language pathology faculty. So some of these individuals are with us today, some are not. Dr. Karen Doherty is a professor in audiology who was our former chair, and she studies hearing loss in aging and hearing aids and speech perception. Dr. Beth Preve is an audiologist who studies pediatric audiology and hearing loss in infants and young children. Dr. Vander Werff is here. I will let her introduce herself.
Good evening, everyone. Very nice to see everybody. I am a professor in audiology, and I'm also chair of the department. So my areas of teaching and research are in auditory evoked potentials and understanding more about auditory processing in concussion and aging and other hearing problems.
Okay, thank you. Dr. Jamie Desjardins is not with us today. She's an associate teaching professor in the audiology program and also directs our undergraduate program. And Dr. Pellegrino is our audiology clinic director as well. I believe Dr. Kennedy and Dr. Kordas are here. Dr. Kennedy, would you like to introduce yourself?
Hi, everybody. Good to see all your faces. I am an assistant teaching professor in audiology, and I teach the second hearing aids class, but I'm predominantly supervising students in clinic, our Gebby Hearing Clinic right on campus. And I have patients of all ages, so infant through up to, older ages, 80 and above. So good to see you all.
Thank you, Dr. Kennedy. And is Dr. Kordas with us too?
Hi, good evening, everyone. I'm Dr. Kordas. I'm associate teaching professor. My areas of interest are actually tinnitus and auditory processing. I teach 2 courses, oral rehab as well as central auditory processing. And then the rest of the time I am supervising in the clinic. So very excited to be here this evening, and welcome to all of you.
Thank you, Dr. Kordas. I was not aware of who is here because some of you may have noticed when you log in, everybody is getting named Rachel Skipper and you have to rename yourselves. Rachel helped us set up the Zoom meeting, and I've never seen this happen, but you all get to share her name today. But it would be great if you could rename yourselves so that if you have questions, we can call you by name. On the speech language pathology side, Dr. Seren Lowell is a professor in the department who teaches our courses in voice disorders and in dysphagia. Dr. Stephanie McMillan is an assistant professor who teaches our courses in child language disorders. I am Dr. Preston, and I teach our graduate courses in speech sound disorders in children. And Dr. Riley is an associate professor who teaches our neurogenic communication disorders courses and has expertise in aphasia. I'm not sure if Dr. Tumanova is here, is she?
Here.
Okay, great. Oh, I think you just joined us. Are you able to introduce yourself?
Hi everybody, my name is Victoria Tumanova. I'm a faculty with a focus on stuttering. I teach courses in stuttering for graduate students and anatomy and physiology for those who are coming in without the background or for undergraduate students. I'm joining a little bit late. My apologies to everybody. Zoom wanted me to enter all of my information if I was a student, and then told me that the host cannot be entering their information. So it took me some time to figure this out, but I'm here. Welcome, everybody.
Thanks. We're glad you made it. Dr. Colleen Gargan also is an associate teaching professor here. She's the director of our speech and language clinic, and she has expertise in autism and in telepractice. Let's see, Professor Lightburn, I think, is here.
Good evening, everyone. My name is Anita Lightburn, and I'm one of the associate teaching professors at in the department. My primary responsibilities are within the Gebby Clinic. And I supervise all of the graduate and some of the undergraduate students who are in our program and have clinical assignments. My areas of clinical interests are in working with patients who are from culturally and linguistically diverse populations, as well as stuttering. So happy to see all of your faces this evening.
Thank you. Our last three, Professor Lister, Professor Vincent, and Professor Valetti are not with us today. All three of them are teaching professors and supervise in our clinic and also teach some of our coursework. Professor Lister has expertise in literacy and language disorders in school-age children. Professor Vincent has expertise primarily in younger children, in preschoolers with speech and language disorders and in apraxia. And Professor Valetti is an expert in aphasia and motor speech disorders and voice in our clinic. So we're going to give you a little bit of an overview of Syracuse to begin with, and some of the highlights of our programs, kind of at the broadest levels, and then we'll break out later on to have some more specific discussions about the speech pathology and audiology programs separately. So some of the things that we think are worth highlighting about our program in speech language pathology and audiology are related to our excellence in clinical training. One of the things we pride ourselves on is that students will begin in our clinic the first semester. So that means that students, even who are coming in without a background in communication sciences and disorders, may be doing observations right away. Students who do have some background may be seeing patients within the first few weeks. So of course, our model is to provide lots of support early on clinically and gradually fade that level of support. But students are able then to connect what they're doing in the clinic with what they're discussing in their courses very early on. Our clinic offers in-person and some telepractice services for all ages and disorder types. Certainly telepractice is something that really increased during the pandemic, but it's here to stay. So it will be part of future service delivery, so our students can get some exposure to that. And as far as clinical training goes, our students begin in the Gebby Speech and Hearing Clinic on campus, and then they also are placed in externship sites in the Syracuse area. There is also cutting edge research going on at Syracuse University in our labs and classes, and connecting also to the clinic. So our faculty are actively engaged in research. So for example, I do research on speech sound disorders in children in clinical trials. Dr. Tumanova does research in stuttering. All of the academic faculty have research labs and are actively engaging with our students as well. Some of our labs involve funding by NIH and by some internal grants and some other mechanisms as well, like foundation grants. We have collaborators inside SU and also outside of Syracuse University, including experts in neuroscience, medicine, psychology, engineering, and cognitive science. Our students are involved in research in a variety of different ways. So I have students, for example, in my lab who work a few hours a week assisting with watching therapy and assessment sessions related to speech disorders in children. Some are engaged in phonetic transcriptions, lots of different ways for students to be involved in our labs. Our students involved in our students connect what they're learning in clinic and their classes and in research to try to heighten their experiences. One thing that we pride ourselves on here at Syracuse University is a commitment to inclusion and diversity. This is presented in a number of different ways. So one way that we do this is through the admissions process. So we don't just look at students' GPAs during the admissions process. We are aware that students have a variety of different backgrounds and experiences, and we take all of those aspects into account when we are reviewing our admissions applicants. So we are a faculty that supports students from underrepresented groups. I'm going to ask Professor Lightburn to jump in with some description of our Align program, if you could.
Sure. One of the things that we have done within our department is to really focus in on trying to support students from underrepresented minority groups. We have a committee that is focused on student diversity and success. And we have a program called Align, which has like 4 different components. One of which is academic skill building and coaching, where students attend sessions to gain just skills in terms of different learning strategies and different techniques to help to improve academics. Another component is facilitated study groups, which are small group sessions that are facilitated by second-year graduate students who actually took the same courses previously. And they help to kind of facilitate and identify some of the key content within different courses. Another aspect of the Align program is peer support mentoring, where a second-year graduate student is paired with a first-year grad student and just, again, provides some peer coaching and some peer support and tips on, success, how to be successful in the program, how to remember to, develop an important routine of like self-care and things like that, and making them more aware of some of the resources that are on campus that are available to students. And then finally, another component of the Align program is professional mentoring. And in this component, our students are matched with a professional in the CSB field, and we have audiologists as well as speech language pathologists. The volunteers or the professional mentors are all people of color. They identify as BIPOC, and so we try to match our students from underrepresented minority groups with these professional mentors to help kind of help them in some of their professional goals and being able to develop appropriate and realistic goals, and just have someone who's in the field who has had certain experiences that will be valuable to be able to share with our students of color. So the Align program has been something that we've been very fortunate to develop over the past couple of years. And if any student has any other questions when we go into our breakout room about that, please feel free to connect with me and ask questions.
Thanks, Professor Lightburn. I do see we have a question already in the chat, which is fantastic. The questions that are there, actually, that is one that we will get to in just a bit. This is a good reminder that I do encourage you to put some questions in the chat. And also we'll have lots of opportunities for questions also in our breakout rooms too. Some of the other highlights of our communication sciences and disorders programs are the externships that are available to students. We have a very strong alumni network, which helps us to have good connections with some of our recent graduates and graduates from many years ago, who are always interested in taking on Syracuse University students during offsite placements. Our clinic directors help our students to set up those externships. So students are not solely responsible for identifying their own externships. So they work with our clinic directors to find placements. And that helps to ensure that students get enough clinical hours in order to meet the requirements for the American Speech Language Hearing Association. So 100% of our graduates in both audiology and speech language pathology have gone on to have jobs after graduation. We've had a very high program completion rate in both programs, and also a very high passing rate for the praxis exam. And the praxis exam is the national exam in audiology and in speech language pathology that prepares students, or that is needed to obtain the certificate of clinical competence in audiology and speech language pathology. So our students are very well trained and are very competitive for jobs when they complete our programs. The application process to our program is through CIDCAS. And this is a website that over half of the programs in communication sciences and disorders use. And it's a common application system so that you only have to enter your name and address and email one time, and it can get sent to many different schools. Our program requires that applications are received no later than February 1st. However, we do have January 1st as a priority deadline. And what does that priority deadline mean? It means that we begin reviewing applications right after January 1st. And some students are anxious about the process. So we review applications as they are coming in. And we do have a process that involves interviews as well for students who we're considering admitting. And so those who apply earlier can kind of get earlier in line for the interview process. So as part of the application process, students submit their grades through CIDCAS, and those grades then get verified by CIDCAS. And so we require that your application is submitted to CIDCAS by February 1st, but it does not have to be verified by CIDCAS by February 1st, because it can take them a week or two to do that. Our application process requires that you submit all of your transcripts. So not only from a bachelor's program, but if you've taken coursework through community colleges and things like that, we want to see all of your transcripts. We recommend that you submit 3 letters of recommendation, and we recommend that at least 2 of them are from academic faculty. So these are professional academic references that we're looking for. We're not looking for personal letters of recommendation. We're looking for people who can speak to your potential success in your coursework or in potentially in a clinical field. We also have an essay that's required as part of the application process. And there are 3 parts to the essay. Those parts are listed both on our website and on the CIDCAS site. And there's an optional 4th essay if you want to be able to provide information about any personal circumstances that you think we should know about when considering your application. Could be related to how COVID has affected you, but it could be related to other circumstances as well. For example, if you had to withdraw from courses or something like that, there's an opportunity for you to explain those circumstances. I will say probably one of my strongest recommendations is that you pay close attention to our essay prompt. Don't submit a generic personal statement. Be sure you are answering the questions that we've asked. GREs this year will be optional for the speech language pathology and audiology programs. And what that means is that you may submit them if you've taken them and if you want us to see them. It's not required. However, Dr. Vander Werff, if you want to just talk for a moment about the AUD PhD and the GREs there.
Sure. We do not directly admit students into the dual AUD PhD program, but if you are admitted to our AUD program and decide and are admitted later to our AUD PhD track, then we will require GRE scores to be admitted to the PhD portion. So if that's something that you think is an avenue that you would like to pursue, you may, and you've taken the GREs or you're thinking about it, it would be probably a good idea to take the GREs now and submit those to us. You could take them later, but they would be required for any PhD component.
And for students who aren't considering the PhD, I think one thing that I would say is that we're looking at the GREs as something that if you've taken them, they could help you in the process, but they won't hurt you if you've taken them and you didn't perform well. So if it's something where you did really well and you want us to know that, then you can share that with us. As far as a basic timeline goes here, we are already in November, so where you should be at is getting familiar with the CIDCAS application portal. Contact people to request letters of recommendation if you haven't done so already, and start entering some of the data into the CIDCAS system. You want to start to request official transcripts and have those submitted to the CIDCAS system soon. And if you're thinking of taking the GREs, you'll want to make sure that you do that. You get signed up for those soon. Again, if you think you might take the AUD PhD route, it's a good idea to think about taking that now. In December, you want to make sure that you're preparing and proofreading your essay. Again, the essay that is very specific to Syracuse University. And make sure by the end of December that all of the people who are supposed to write letters of recommendation for you have submitted them through the CIDCAS portal. Again, our priority deadline is January 1st. Our final deadline, though, is February 1st. So if you don't make January 1st, that's okay. But we want to make sure that you've clicked submit and sent all your materials by February 1st. And it will be in February that we will be conducting interviews based on the applications that we've received. And our goal is generally within the first couple of weeks of March to be sending out notices to individuals about whether they've been accepted. And Dr. Vander Werff, if you could give us a little bit of an overview of the financial help that's available for students here.
Yes, sure. And on that note, I was just answering a question in the chat that Sarah brought up about GRE scores. GRE scores will not affect your application in terms of admission or opportunity for financial help. So we do have, there are some opportunities through CIDCAS in terms of if you have a relatively low income in terms of how they define it on the CIDCAS website, that you may be eligible for a waiver of the application fee on CIDCAS. And I would encourage everyone to look into that option because every year they have a number of these fee waivers that are available, and often they're not all used. So if you're eligible, that is a great opportunity to save money on the application fees. All of our applicants are going to be considered for tuition scholarships and any other awards that we have. You don't have to apply separately for any financial award. We will consider all of our applicants, and in fact, every one of our entering students last year and for the last couple of years has received some financial package that typically includes tuition scholarships of some amount, which means that you get offered an award that covers a certain number of credits towards your degree. So that is true for both speech pathology and audiology. And so everyone is considered and will be offered some amount of financial award. We also have a limited number of teaching and research assistants available. Some years we have a couple of them, some years we may not have any for incoming students. But if we do, again, they are not something you need to apply for separately. We will consider students as we review your application for admission. We often have those available for second or third year students who we, after you've been admitted and we already know you and you're doing well, we may offer those assistantships to help teach classes and work in research labs. All right, thank you.
Thanks. And this is just a brief summary of the applications that we've received over the last 5 years. On the left is speech language pathology. And this is just broken down by students who apply with a background in communication sciences and disorders and without. So even though the majority of our applicants do have an undergraduate degree in CSD, we definitely get a proportion who do not, and that's okay. Our programs can accommodate students who do not have an undergraduate degree in communication sciences and disorders. So a typical entering class for us in speech language pathology is about 26 students, about 20 with a background in CSD, about 6 who don't. And in audiology, our typical incoming cohort is around 10 students. Again, about 8 who have a background in CSD and 2 who don't. As far as the requirements for students, the American Speech Language Hearing Association has some prerequisite knowledge and skills that are required. So all SLP and audiology grad students are required to demonstrate knowledge in the area of biological science, physical science, statistics, and social behavioral science. So these are courses that aren't required to be admitted, but they have to be completed before graduation. So students who don't have them when they start our graduate programs would have to take them during the program. and a C- or better is required. And these have to be done before completing graduate school. This is a requirement of ASHA. So we'll talk briefly about the master's program in speech language pathology, and then after that, we'll briefly discuss the audiology program. So we have a master's program for students with a CSD background that's between 46 and 53 credits, and that typically is a 5-semester program. So fall, spring, summer, fall, spring. And our program for students without a background in CSD is an extra 2 semesters. So essentially, there's a couple of semesters that are spent taking some of the background courses that some of the other students would have had they, some of the students with a background in CSD have already taken, such as the ones listed down below here. So students who come in with a full background, we expect that they've had a course in speech science, phonetics, anatomy and physiology, development of speech and language, clinical methods, observation, speech sound disorders in children, and basic clinical audiology. Some students who are accepted to our program who maybe are missing 1 or 2 of these may sometimes take these courses in the summer before they begin, or we can work with students to discuss taking these during the program as well. And the audiology clinical doctorate, Dr. Vander Werff, I'll give you a chance to talk about the AUD program here.
Okay. We have our AUD program does not require people to come in with a background in communication sciences and disorders. However, we don't have a specific track for students who don't have a background. And in that case, we do recommend that you have some prerequisite courses just to be able to complete the program on time and to kind of lower your stress level in jumping into the program. So we do have a 4-year program that includes the 4th-year externship, which is the year-long. So it's 3 years in-house. And we do still require the same ASHA prerequisites of the basic sciences and statistics that Dr. Preston just mentioned. We also do require as prerequisites or as electives during the program that you have a class in normal speech and language development and an American Sign Language class. So those 2 classes are not part of our 92 credit program, but they are required for your ASHA knowledge and skills. So if you don't have those in your undergrad program, you can take them in the summer, you can take them as electives in your program, because there are 2 electives, open electives during the audiology program. I highly recommend that if you do not have a background in CSD, that you at least take a hearing science or an acoustics class and an intro or basic clinical audiology class. Those 2 classes will set you up well for starting the AUD program. You can start our program without those classes, but a number of students find it incredibly difficult without having those classes. They're trying to catch up during their first year. And so if you can take those during the summer, if you haven't had them, that will give you a leg up in starting the program.
Thank you. And Jamie has a question about, I guess, probably for the SLP program. Students who don't have a bachelor's degree in communication science and disorders, but have taken all of these courses, could still be considered to be a student with a background. So if you got a bachelor's in psych, for example, and then you took all of these courses, you could still be considered a student with a background. We also have sort of students who have partial backgrounds, maybe who have half of these courses. So we work with students to figure out their own individual schedule if they have some but not all of these courses. I also see a question about a course in psychological statistics, whether that would count as a statistics course. In general, yes, but in some cases, if we're not sure, we'll ask for copies of the syllabus for courses that you've taken if we're not sure that they'll meet This is in reference to the ASHA requirements listed here. If we're not sure if your course would count, we'll just ask for a copy of the syllabus and we'll let you know if that would count. So what I'm going to do now is switch my sharing of my screen here and share with you both a tour of our clinic and some student testimonials. Okay, so this first is an overview of our clinical facilities. Since we're not doing this in person, this will just give you a sense of what our clinic and some of our laboratory and academic space looks like here.
Syracuse University's nationally ranked graduate programs in speech-language pathology and audiology have state-of-the-art educational, clinical, and research facilities, which were recently renovated and expanded. The Gebby Clinic is the training site for undergraduates majoring in communication sciences and disorders, and graduate students enrolled in the speech-language pathology and audiology programs. Services are provided to pediatric through geriatric populations with conductive and sensory neural hearing loss, speech, language, and swallowing disorders. Our clinic is equipped with a state-of-the-art digital video and sound recording system with built-in cameras in each treatment room. This allows for live recording and viewing of assessment and treatment sessions for family members, supervisors, and students to review. Diagnostic evaluations and adult treatment services are performed here, including an adult aphasia group for developing functional communication skills. The attached observation room has a wall of one-way mirrors and headphones for direct observation of diagnostic or treatment sessions. Our large pediatric treatment room is equipped with multiple cameras to capture treatment group activities addressing social pragmatic skills, fluency skills, language, and/or literacy skills. Our clinic is also equipped with the optimal therapeutic materials for effective intervention and the most current, evidence-based diagnostic standardized tests spanning all ages and diagnoses. The Audiology Clinic has 2 state-of-the-art, double-walled, double-sided sound suites. The oversized booths have glass panels giving them a spacious feel. Here, we carry out a variety of diagnostic procedures, including audiometry, otoacoustic emissions, tympanometry, auditory processing disorder testing, tinnitus treatment, and pediatric assessments. Our hearing aid suite features a programming station, 2 VeriFit hearing aid analyzers, a living room styled area for assistive listening device demonstrations, and a hearing aid repair lab. 4 in-wall speakers allow us to simulate many different types of listening situations, such as a restaurant or a noisy room, so clients can try their new hearing aids in these real-life situations. The clinic works with many different hearing aid manufacturers, allowing students to gain strong, foundational hearing aid skills across several levels of technology. The vestibular lab features the latest video nystagmography equipment, which allows for testing of vestibular or balance disorders. Our clinic is also equipped with a video otoscope connected to a 60-inch monitor, a key teaching tool enabling students to explore and display images of the human ear canal in real time and discuss patient test results as they happen. Classrooms in the Gebby Clinic are equipped with smart classroom technology and modern seating. Just down the hall, there is a student computer room and a comfortable and convenient student break room. Faculty offices are in direct proximity to the clinic. Our students and clients benefit from the outstanding facilities and resources that our department offers. We hope that you will come visit us in person.
That's an overview of our facilities. The next thing I'm going to show you now is just some testimonials from some of our students, both from speech language pathology and audiology.
Hi, my name is Michaela, and I wanted to talk about why I chose Syracuse University for the Speech Language Pathology Master's Program. I did my undergrad at SU, and my majors were psychology and neuroscience, but I wasn't really sure what I wanted to do with that. But for that program, you have to take a class called Cognitive Neuroscience of Speech and Language. And when I took that class, I absolutely loved it. I loved going every week. So I got to know the professor of that class, Dr. Riley, and I got the amazing opportunity to assist in her lab. And after doing that for a year, I got to know so many of the faculty in the CST department, and I got so many amazing opportunities in the lab. And just, getting to know the department and getting to know everybody, I knew that I definitely wanted to come here for my master's, and I love it here.
Hi, my name is Chloe, and I'm a second-year doctoral student in the audiology program. I really like Syracuse for a number of reasons, but one of the biggest things that drew me into this program was knowing that I would get early hands-on clinical experience. So as students, we begin working with patients right away, and I found that having that early clinical experience to be so helpful for the development of my skills to not only interact with patients, but to be able to do it with confidence. What I also like about Syracuse is not only the early clinical exposure, but also the exposure to different clinical settings. So for example, right now I'm working at an ENT office, which I really like because no day is the same, but each day is really interesting. And so I like that the clinical rotations have been implemented into Syracuse's program. But what I can say that I like the most about being here at Syracuse is the support system that I have here. I can confidently say that between the students, as well as the academic and the clinical staff, that I really do feel like I have a sense of community here at Syracuse. The staff, they're extremely supportive, they're very approachable, and they give you all the tools and the equipment needed to be a successful student and a confident and empathetic audiologist.
Hello, my name is Abigail and I'm a first-year audiology student. There are a lot of reasons why I decided to come to Syracuse, one of them being that it is a beautiful part of the country. There are a lot of things to do in the outdoors, which I know that I love, and it's really just a fantastic place to live. I also have loved how responsive and how helpful the professors have been. I moved all the way across the country to come here to Syracuse, so having those professors there to answer the questions and doing it in a really timely manner really helped me, and they've continued to be that helpful since we've got here. Another thing is the hands-on experience that you get in the clinic starting the first semester. I know that sounds very intimidating, but you have clinicians side by side with you. You are not alone, but you really can't replace all of that hands-on experience at all. It's been so helpful. I feel like I have learned so much just in my first semester, and I can't wait to keep learning more.
All right. My name is Cora Krifkin. I'm a second year speech language pathology graduate student at Syracuse University. I wanted to talk today about some things that I'm thankful for that I have access to at SU. The first thing that I'm thankful for is the opportunity to engage in research. Syracuse University is an R1 research facility, which means there's lots of projects going on and a lot of them have really good funding. I personally worked in Dr. Preston's speech production lab, where he's gotten NIH grants before. So it's really cool to be a part of the study. I was a transcriber, so I transcribed the speech of children with childhood apraxia of speech. For me, this was like an invaluable experience because it taught me a lot about how to transcribe speech of children with disorders and how to become more proficient in that. Another thing I'm really thankful for is the close relationships that I've built with faculty, both clinical and for my professors. I feel like it's really difficult in this program to fall through the cracks, and that everyone here is there to support you and they want you to feel like you have a structured support system. So you meet every single week with the clinical faculty that you work with at Gebby Clinic, and you, if you are falling behind in your classes, your professors will help reach out to you or will encourage you to come to office hours, and they're always available at their office hours and are willing to help. I know personally that was huge for me because like any other student, grad school can get stressful at times, and so it's really nice to feel as if you're seen and heard, and that's been very wonderful. And lastly, the one thing I want to talk about the most is probably the equal balance between school-based information and medical-based. In many programs, you either get a program that's heavy in school-based information and school-based SLPs on staff, or you get a program that's heavy in medical-based SLPs on staff. So you only get one or the other. But in this program, for somebody like me, who is very indecisive and doesn't know what I want, it was really nice to get a good balance of both so I can see the benefits and the strengths of both parts of the field. And that's really my three main reasons I'm thankful about going to Syracuse University. I really hope this was helpful for you, and I hope that you plan to come. And if you do, I'll definitely say hi. It was really nice talking to you all. Have a great night or day or whatever.
But really, our next steps here, we're going to do just a brief overview of what the clinical experiences are like. So Now I'm going to ask first Professor Lightburn to talk a little bit about what students might expect their first couple of semesters in the Gebbie Clinic to be like on the speech side, and then we'll ask Dr. Kennedy and Dr. Kordas to describe the audiology side. So Professor Lightburn, if you could start for us.
Sure. So when students are accepted into the program, students with a background, as you've heard from the testimonials of our students, they begin right away in our clinic. And students without a background, they actually take the first semester, usually to obtain their 25 hours of direct observation or of observation. And so oftentimes that first semester, much of what is assigned to students without a background is related to them completing those 25 hours, but students without a background also have the opportunity to get involved in some experiences in our clinic. For the students with a background, usually you would start out with maybe 2 clients, really depending on, say, if maybe you have had some clinical experience in your undergraduate program. You may possibly have 2 or 3 clinical experiences, but definitely no more than that. And as you've heard, all of our students, once they are assigned to a clinical experience, they are set up with a weekly appointment with our clinical teaching staff, and you meet prior to your session. We are required by ASHA to observe about 25, I think it's just 25% of your sessions, and it is very, very rare that students have anything less than 50% of their sessions directly observed. We have a number of different types of experiences, individual therapy sessions. We have children from the preschool years all the way through adults who are in their 90s or more. In some of our clinical offerings or services that are provided, we have a number of different groups. Dr. Preston mentioned one of our clinical teaching faculty, Professor Voletti, who runs our aphasia group. We have a number of different types of groups that are offered for services, a social skills group. Many of the children in that group are on the autism spectrum. We have quite a few stuttering groups, some of which Dr. Tumanova and I work collaboratively on. We have groups, fluency or stuttering groups from the ages of preschoolers all the way through adults. And we have different opportunities to work with people who have voice disorders. We have our sessions for a number of children who have apraxia of speech and other motor speech disorders. There's a wide variety of disorders that are seen at the Gebbie Clinic. We have students and clients rather who come in for language disorders as well. So you have the opportunity to get a number of hours from a broad range of different communication disorders and are well supported throughout for WOBS, the 3 semesters that you are in the clinic. For students with a background, I should say, you are in the clinic for 3 semesters. For students without a background, you are in the clinic for a little bit longer. You're in the clinic for 5 semesters. And you are supported as well throughout all of your time at the clinic. You gradually have more students in your assignments based on the experiences that you have and where you are in the program. But you are well supported through each of the experiences because you're often treating a disorder and taking a course maybe simultaneously if you haven't already taken the course. And so we want students to understand that you will have guidance for everything that you're doing.
Thank you.
I'm sure there's things I left out, but please feel free to ask questions.
That's great. We can also do some more in the breakout rooms too. And our speech students, after they've done their semesters in the Gebby Clinic, our speech students do 2 full semesters of externship as well. They do a pediatric placement and adult placement. So maybe Dr. Kennedy, if you could give us an overview of what some of the audiology students might expect their first couple of semesters in the clinic.
Sure. So I think our program is unique in that we, in the very first semester, pair a first-year student with a newly crowned, I guess, if you will, second-year student. And those pairings have worked out really nicely. You get to, one, get some interaction with the group that came in just prior to you, and it takes a little bit of pressure off of that first week experience of meeting with patients, so that if you're coming in without any experience with working with patients, they're going to model that for you. They're going to ask you to be right there with them the whole time and absorb as much as you can. And then gradually over the semester, as you're learning the different diagnostic testing for audiology, as you're learning those, we're going to be incorporating those into clinic, and you'll get more and more hands-on experience and less observation as the semester goes on. The patients that we see in the Gebby Clinic will be, I think I said earlier, of all ages. We have contracts with early intervention agencies that refer little infants, although from basically age 0, not quite 0, but 1 week. I've seen very, very little babies, all the way to age 3. And we also do some preschool hearing evaluations as well. We have a nice pediatrician base who refers to us for those testings. We have a couple of times per week that we have available for central auditory processing disorders. And we do have a fair number of adult patients as well that are coming in for their evaluations, their hearing aid consultations, their hearing aid deliveries, and any problems that they might have with hearing aids. So you could expect that in that first week, you might not be doing a complete audiological battery, but you'll probably get a chance to interact with patients, to listen to hearing aids that come in so that you can get a sense of what is a hearing aid that works and what is one that doesn't. There's a couple other, actually, if I could bother Dr. Kordas to talk a little bit about some appointments that are related to tinnitus, that would be great.
Trying to start my, okay, good. I'm trying to start my video here. Usually the tinnitus slots are reserved for patients who have to report bothersome tinnitus. So this is tinnitus that really affects quality of life. During your first year, you're usually paired again with a mentor, and that mentor is in, it kind of takes the role as a leader to really evaluate the tinnitus patient and then give proper management strategies, which usually involves combination instruments or sound therapy, or maybe even a referral for cognitive behavioral therapy. So that's, those sessions can be quite long, but also very rewarding, because I think it's an area of audiology where those patients just need a lot of help and support, and that's something we can provide at the clinic. And the other thing I wanted kind of to point out is during the first year audiology students do not go on placement. They are at the Gebby Clinic the fall, the spring and the summer. So you're really getting kind of a hands-on, we're kind of holding your hand, but yet you're getting all different experiences at the clinic. And we can talk a little bit more when we get into the breakout rooms, but that's kind of a nice summary of how we diagnose and treat patients who have bothersome tinnitus.
Thank you. I'll address one question that I see in the chat, which is related to students who come in with undergraduate clinical hours. And as a general rule, on the speech side, I can at least say ASHA requires that students have at least 400 hours, clinical hours, to be eligible for their Cs. Students who come in with clinical hours, we don't necessarily assign you fewer clients because it's not like once you hit 400 hours, you stop doing clinical training. So our students might get 450 or 480 clinical hours. So it's great when students have undergraduate clinical experiences, but it doesn't mean that you won't have clinical experiences here. So what I want to do is make sure we have some time to have some more specific discussions for each cohort. Dr. Vander Werff, I think you created some breakout rooms for us for each group. You can ask questions about the academic program, the clinical side of things, whatever you want. I'm going to remain here if anybody has a question specifically for me about the application process or kind of a one-on-one question. Otherwise, I think in the audiology room, Dr. Vander Werff, Dr. Kordas, and Dr. Kennedy will be there. And in the speech room, Dr. Tumanova and Dr. Lightburn will be in there.